Hey friends, let's talk anterior aka anterior lateral hip precautions in today's OT Minute. Don't forget to like, subscribe, and share if you like this content. Welcome back to the OT Minute. My name is Arno. I'm a third-year OT student. There are two main approaches that surgeons use for hip replacement surgeries, also known as hip arthroplasties. This includes posterior aka posterior lateral and anterior aka anterolateral approaches. In this video we will talk about the common precautions after an anterior hip replacement surgery. I also have a video on the posterior hip replacement precautions. If that's something that you're looking for, you can click on the card above and go right to it. Before we go over the anterior hip precautions, I do want to make an important note about precautions that we need to keep in mind. The following precautions that we will go over are just general anterior hip precautions. Always follow the surgeon's hip precautions or instructions, and if you have any questions, concerns, or confusion about the precautions, it's always better to ask than to risk injuring a patient. The reality is that there are variations to these precautions, and a surgeon may be more conservative or more aggressive in the rehabilitation of their patient, depending on a range of different factors. In addition to hip precautions, it's also important to make sure we know the weight-bearing precautions for these patients, because that may vary as well. Now, anterior hip precautions generally include three things. First, avoid extension of the affected hip. Second, avoid external rotation of the affected hip. And third, avoid adduction of the affected hip, such as crossing legs or feet. I find it's helpful to think through daily ADLs and common everyday activities to make sure that I'm thinking practically of when might a person be at the highest risks for these specific movements. In other words, when may a patient be most likely to extend or externally rotate or adduct their affected hip. For example, when getting out of the car, externally rotating or adducting the hip is what we're used to doing, so helping patients or clients be aware of these higher risk moments can help them anticipate, practice, and plan ahead to avoid injury. Occupational therapy practitioners are experts in activity analysis, so working with the client and getting a sense of their routines and their occupations and their physical environments during the occupational profile or evaluation stage can help therapists ensure client-centered education that will help keep the patient or the client safe as they are starting to re-engage in their meaningful daily occupations. It's also important to note that there have been many great advances in hip surgeries over the years, and some surgeons may not even have precautions outlined for patients. Again, always look at the available medical charts and ask if you have any doubts or questions about precautions. If you're like me and you're always looking for ways to memorize this content for the long haul, here's just a quick little tip. I use the equation add E and E together, and that equals your anterior hip precautions. Add refers to adduction, E for external rotation, and E for extension. So those three things make up your anterior hip precautions. If you found this information valuable, please drop a like or a comment down below to let me know, and subscribe for more OT related content. And don't forget to click the notification bell that lets you know when new videos on the channel is coming out. I hope to see you in the next video. Have a great day.